Welcome to the American Hospital Association special podcast series, Just Lead, a look at how hospitals and health systems that have been recognized with AHA awards for innovation, collaboration, and health equity are transforming healthcare to better serve their communities. So what does this mean for patients? Thanks for joining us. I'm Tom Hedderly with AHA Communications. Carolyn Boone Lewis was a tireless advocate for equity in healthcare. She was also the first African American and first hospital trustee to serve as board chair of the American Hospital Association. The AHA acknowledges her lasting contributions with the Carolyn Boone Lewis Equity of Care Award, presented annually to recognize the outstanding efforts among hospitals and healthcare systems to advance equity of care to all patients and spread lessons learned and progress towards diversity, inclusion, and health equity. Today we are joined by the recipient of AHA's 2022 Carolyn Boone Lewis Equity of Care Award, Mount Sinai Health System in New York City. Here to share their story with us is Shana Dacon-Pereira, Senior Director for the Office of Diversity and Inclusion at Mount Sinai.
Hello, everyone. This is Dr. Leon Caldwell, Senior Director for Health Equity Strategies and Innovation at the American Hospital Association's Institute for Diversity and Health Equity. I am very pleased to welcome to this conversation Shana Dacon-Pereira, Senior Director for the Office of Diversity and Inclusion at Mount Sinai Hospital in New York. I have the esteemed excitement to say that Mount Sinai is the 2022 winner of the Carolyn Boone Lewis Equity of Care Awards. Thank you for being here and really looking forward to having this conversation with you.
Thank you. I'm looking forward to it as well.
So it's a lot of hard work doing diversity work, right? Or equity work, particularly in a field that is constantly moving and changing. Tell me more about Mount Sinai's work in this space.
Sure. So Mount Sinai's work in this space has been long-standing. And I think when I think to, what has been successful for us in getting to this point, I think it really is vital that you have leadership support and buy-in for any health equity and diversity and inclusion initiative. So at Mount Sinai, we've been able to create a leadership accountability structure that enables our leaders to come together and really evaluate their progress on certain initiatives. We started a few years back an Executive Diversity Leadership Board, which is chaired by our CEO, Dr. Ken Davis. That board consists of senior and executive leadership across the health system, as well as some members of our boards of trustees. And they are really charged with setting the diversity, equity, and inclusion strategy for our health system, as well as really looking at efforts that can really elevate marginalized and underserved populations. And so the expertise, the experience of our leaders in both setting the strategy and leading by example, I think has been crucial to that success. And so for any hospital or health system really looking to get into this work, having that commitment from the top is important, and then having those leaders demonstrate those behaviors that they really want to instill in the health system is important as well.
So it sounds like what's a critical piece of doing this work is not only leadership buy-in, but a strategy.
Absolutely.
And can you tell more about how did you come up with the strategy? It sounds a really inclusive process as well. Can you talk about that?
Absolutely. So when we first put together the diversity leadership board, one of the things we did was set some domains in diversity, equity, and inclusion that were important to our health system. And along with those domains, some areas of focus through which the work gets carried out. So those domains include cultural effectiveness and education, which is really all of the educational courses that fall under our DEI educational portfolio, really educating our staff and leaders about why this work is important. Disparities in clinical outcomes, so really examining our data and looking to see where we can identify those disparities that we need to address throughout the health system. Engagement and inclusion, that really speaks to the grassroots work of our diversity councils and employee resource groups and our leadership support of those groups. Enhancing demographic diversity, so looking at how we are recruiting and retaining staff, particularly staff of underrepresented groups in healthcare and medicine. And then lastly, external relationships. So how are we building relationships with our community? How are we partnering with them? How are we supporting minority and women-owned businesses? So those are the 5 overarching domains. And the leaders in our Executive Diversity Leadership Board were really tasked with, okay, take these domains and set some strategic priorities. What is important in your area of oversight around these domains that you want to address? And what are some goals that you can set around them? And then, they would report back to the board and present those priorities and their progress towards those. And so that's, when I spoke earlier about the leadership accountability structure, that's how we kept them accountable to that. And then, we've done some other work throughout the health system, in terms of setting strategy. We looked at, okay, what other things are important for us to focus on. So we started looking at population groups that are, in addition to racial ethnic groups that we know are affected by health disparities, looking at people with disabilities and focusing on accessibility, looking at our lesbian, gay, bisexual, transgender, and gender non-binary population, and making sure we create an environment that is safe and equitable and focuses on person and patient first for those populations. So all of that has been important to our strategy. And I'd be remiss if I didn't mention the work of our Icon School of Medicine at Mount Sinai as well, our medical school, who in 2015 really started focusing on racism and bias and has been at the forefront of that work for medical schools across the country.
That's great. One thing that's really important in all this work, so if you go to equity.aha.org, and look up the health equity roadmap that AHA has put out, you'll see a continuum that goes from exploring to transforming. And exploring is really around developing a plan, right? A strategy. When you go to committing on that continuum, it's about implementing the plan, right? What was the implementation like? Because it's one thing to draw up a good strategy. Are there lessons learned in how you've been so successful around implementing the actual plan?
Absolutely. So when I think about lessons learned, especially when you're talking about health equity work, one of the things is understanding your community. If we don't understand the communities that we serve, then how are we supposed to be able to meet their needs, right? So it's inviting them in. It is, going to those community board meetings, which our community and governance department goes to and attends. It is really speaking to those businesses and understanding what their needs are and how they can work with our organization, setting favorable payment terms along with our supplier diversity initiative. So understanding the community is one. The other lesson learned for us is really trusting the community. So it's one thing to understand them, but then trusting them to really carry forward any health equity and public health initiative. To that point, I can think about the work of our Institute for Health Equity Research. So that institute was formed a couple of years ago with the goal of really looking at the magnitude of the impact of health disparities on Black, Latinx, low-income, uninsured, and other vulnerable populations. And so the work that they've done, especially this past 2 years with COVID, they have gone out into the community, done town halls, educating the community leaders on how to do research in their own community around disparities. They've had sessions where over 200,000 New Yorkers have attended to learn more about COVID and vaccination. And so it's really getting into the community and doing that work that's been successful. And then the third lesson learned, and I can't reiterate this more, is that leadership support and buy-in, right? And then identifying those key internal and external stakeholders that are important to moving the work forward. Sometimes that's community members. Sometimes it's a student in our medical school. Sometimes it's, the housekeeper on the floor that we need their voice to truly make inclusion part of this conversation. So those are some of our lessons learned.
Yeah, that's incredible. I really like this notion you've landed on a couple times, that's leadership support. So you're a phenomenal leader. You're pushing this work in communities that are sometimes not hard to serve, but hard to really trust our systems, if we want to think of it in that perspective. So in this notion of kind of leadership support, how did that come about? Was it a push-pull? Was the leader standing in front? Because these things really don't go until someone who has resources and can command resources and says, this is our course, right? And then sets the framework, right, and the foundation for which organization can move. So just tell about your leadership support and then the overall leadership support.
Absolutely. So talking about my own leadership support within the Office for Diversity and Inclusion, we have a very strong team. Our Chief Diversity and Inclusion Officer and EVP for Diversity and Inclusion in the health system is Dr. Gary Butts. And alongside him, we have two other leaders, our VP, Pamela Abner, who is really our Chief Diversity Officer in terms of looking at operations in our hospital groups. And then Dr. Angel Palermo, who really looks at DEI education and training, not only in our hospital, but also our medical school and doing that work as well. So we have very strong and supportive leaders in our department who allow us to bring forward ideas and really, support our team in pushing these efforts forward. In the health system as a whole, I'll speak to two different things. The first is, in submitting this application, we speak a lot about our roadmap for action. And so our roadmap for action to address racism was launched last year in 2021 with the support of an interdisciplinary team that consisted of leaders, faculty, staff, students, board of trustee members, really everyone. And that was crucial and integral because we wanted to get voices from across the health system to help identify what were those areas that we needed to look at to address racism in the health system. In working with that team and the leaders in that team, it was important to understand that not everyone is in the same place when it comes to understanding racism or addressing racism. And so it really took a lot of self-reflection for the leadership of that team and for the members of that group to look at, what were their own thoughts about understanding racism and where we are, and how can we move from a fixed mindset, which is really based in fear and not wanting to have the conversation, to a growth mindset where we are open and vulnerable and able to share our thoughts freely and openly and trust each other in that process. So in doing so, our leadership team that was part of that task force to create the roadmap was truly able to come together, dedicate their time and resources to really establish this guide, which we now have and are working to implement. The second piece that I'll speak to is the work with our Quality Leadership Council. So our Quality Leadership Council is made up of clinical and quality leaders across our health system. And we did something very similar with that team, right? We focused on educating them around racism and how it affects and impacts health disparities. We spent time, reading books such as White Fragility, such as So You Want to Talk About Race with that team, and really getting the leaders to share their feedback on what these books meant to them, what the concepts were, having some of them share testimonials on their experience reading the book. And that helped them to understand what were these systems of oppression that were really driving the health disparities we were seeing. And so after doing all of that work, our Quality Leadership Council was really able to push forth efforts to make equity a core value of our health system, which it now is. So I think having conversations with the team, storytelling has been powerful to getting these leaders commit to making true change and really, creating an environment where we trust each other and all feel included has been important to that leadership support.
This is what we often don't talk about in the equity work, really our own personal transformations, right? And it sounds like a good part of this work was setting the emotional stage for the cognitive process for change and transformation around equity. So this is I think it's an incredible lesson to have because oftentimes you may think, we'll just do a workshop here, we'll do a workshop here, we'll do a program here, and change will happen, right? But the work that you all put in to set the tone for really equity as not just a performative process, but as a personal kind of mission statement is really a part of this shared accountability that we all have or want to have in our organizations. So this has been incredible to hear the work. Like you see it on on the video with the awards, but just to hear the insights that go into an organization's kind of transformation around this work. Is there anything else you want to leave us with?
Yeah, absolutely. Just speaking to your last point, we were very intentional with the leaders who are involved in our roadmap and those who are now strategy leads. I mentioned the 11 strategies of the roadmap, and we've identified leaders to be the strategy leads to push that work forward. We were very intentional day one to let them know, this is not going to be a one and done. This is not a one day we fix everything and then we can move on with our lives. This is forever work. And so for it to be forever work, we need forever change in our hearts and in our minds to really push this forward. So I think that's important. And we've done the same in our educational sessions, right? So we have numerous educational sessions from, talking about cultural awareness, cultural effectiveness, thinking that it's not enough to be competent about this work. We have to be effective in making the change, right? So we talk a lot about unconscious bias and how that affects us. We have educational sessions around data and disparities, which that work has also been important, collecting our patient data and having our staff understand why it's important to collect that data so we can identify those trends and come up with innovative solutions to really address the disparities that we're seeing. And even in our recent efforts on having conversations about race and empowering our leaders, how do you have this conversation with your staff, with your peers? All of that takes a bit of self-reflection and a bit of sharing and a bit of storytelling. And stories can be transformational. So, the more that we're able to just have these discussions, talk about the importance of our work, the more that we're able to truly start to change those hearts and minds and make this lasting change. So again, to others looking into doing this work, it's not as easy as it looks, certainly. Those of us who have been in diversity for a while know that. It's not as easy as just, reading from a paper and saying, this is how we implement it. It truly takes doing that research, reading literature, reading articles, reading books, and changing yourself so that you can tackle these issues.
Well, on behalf of the American Hospital Associations, congratulations to Mount Sinai for this incredible work and your insights on how to move the needle in an organization. And we do know it's a process, so we'll look forward to hearing more and more about your kind of pivotal and transformative work in health, in hospitals and healthcare. So thank you so much. This has been a great part of the journey of learning more about the inner workings of transforming systems and moving to more equitable care delivery.
Absolutely. Thank you, Dr. Caldwell, for this opportunity. And we look forward to more and seeing where we are 5, 10, 15 years from now as well.
Awesome, Shana. Thank you so much.